I'm Xavier Becerra, the chairman of the Democratic Caucus. Pleased to be joined by our Vice Chairman Joe Crowley of New York. And today we're pleased to be joined by two of our colleagues, Congresswoman Dina Titus of Nevada and Congressman Marc Veasey of Texas. We're here to talk principally about health care and the fact that so many Americans will now have access to it. We had a good caucus meeting today where we discussed a number of issues, including, of course, moving forward with our economic challenges and making sure we don't go through the same manufactured crisis of watching our government shut down and the potential of America defaulting for the first time in its history in paying its past debts. And we think we can build now, after last week's agreement, on the types of measures that are necessary to get Americans back to work. We heard that some 150,000 Americans got jobs in the last month. That's good. Not good enough. We want to continue to see that improve because we have to make up from the Bush year recession where we saw some 8 to 9 million Americans lose their jobs. And so a lot of progress has been made, more than 3.5 million jobs created. 7.5 million jobs created in the last 3.5 years. That's good, but we still have a lot more to do because Americans want to know that there's going to be a good job waiting for them that helps them with securing the American dream for their families. On the Affordable Care Act, a lot of us want to see this move forward as quickly and as well as possible because for many of us, the issue is real about making sure Americans have access to quality, affordable health care. It's time for Americans, all Americans, to have the security they need in knowing that a health care bill will not push them into bankruptcy. And that's the beauty of the Affordable Care Act. The new health security law makes sure that Americans finally can rest assured that they will have access to a decent doctor and a good hospital should they need either of those for their kids, for their family. And so we're here to push as hard as we can to make sure that all Americans get to enroll in these new affordable plans that are being made available to them throughout the country. We're concerned about the process. We're not happy if the process doesn't work well. We're not interested in hearing about glitches. We're interested in moving forward. But for us, while the process should not be a problem, our biggest concern is with the product. We want the product to be there for many Americans. And you have before you, well, actually, in this case, 3 of the 4 of us happen to know what we mean when it comes to trying to get Americans affordable health care insurance. Because Mr. Veasey, Ms. Titus, and I happen to represent the 3 most uninsured districts in the nation when it comes to Americans having access to quality, affordable health care. And so while the glitches are upsetting, it would be a travesty if we on January 1st didn't see that Americans actually got to start using their health care insurance that was made available through the Affordable Care Act. And so we want the process to improve, but we're not interested in trying to torpedo the process. We want to improve the process as quickly as we can because a whole lot of the folks who are going to need to have a good process and therefore gain a quality health insurance plan for their family live in our districts. And I know that Mr. Crowley's district also has a lot of Americans who are interested in accessing good quality, affordable health care. So we're here ready to work. We had some individuals from the administration, from the Health and Human Services Department come and tell us what the latest was. They told us of all the work that's being done as a result of the president's urging to try to deal with some of the errors that were occurring with the website, how they've improved that, how they're moving forward with more access to phone coverage to give people access to that information, and of course, person-to-person communication as well with those who are interested in applying for the health care plans. We believe that come January 1st, a lot of our constituents are going to have access to a quality, affordable health plan, and we're going to do everything we can working with our colleagues and working with the administration to make sure that's exactly what happens. Because at the end of the day, no process should bog down people getting a good product make sure that they have good quality coverage on health insurance for their families. With that, let me yield now to our Vice Chairman, Mr. Crowley.
Well, thank you, Xavier. I take it that's one club I guess I'm glad I'm not in, that I'm not in the top three. But there is no question that, as well as New York is doing in this process, there are still 155,000 constituents in my district who are currently uninsured, and they look forward to the opportunity many of them for the first time in their lives to afford health insurance. It's also not just about a website. Health insurance is about health security for millions and millions of Americans who heretofore have not had the ability to afford health insurance. And under the Affordable Care Act, that's about to change for them. But what can't get lost here, as I said, is that this will give millions of Americans the access to quality and affordable health care. What also can't get lost here is that diabetics and cancer survivors will no longer be denied coverage for pre-existing conditions. What can't get lost here is that medical decisions will be made by the patients and their doctors and not insurance companies. What can't get lost here is that for the first time, millions of Americans will finally be able to get insurance. And in fact, one sign of how much my constituents need this law is that more New Yorkers have completed an application and received an eligibility determination more than any other state, no offense to any of my colleagues here. So New York is doing quite well. So does something need to be done to fix the technical issues? Absolutely. But we can't lose sight of the fact that this law is giving millions of Americans options for quality, affordable health insurance for the first time in their lives. Republicans are looking for problems to exploit. We Democrats are looking for problems to fix and to find solutions for. We just saw the shutdown of the United States government. The government of the United States of America was shut down in an effort to undermine the Affordable Care Act. They used the threat of defaulting on our debt, again, to undermine the implementation of this law. Really, one has to start to question the motivation behind much of the angst that we're seeing out there with the Republican Party as well today. So with that, I will now turn this over to Dina Titus from Nevada's 1st District.
Thank you. Thank you. I'm Dina Titus, and I represent the Las Vegas Valley. As you have heard, Nevada is always one of the top states for the percentage of people who are uninsured. Some 200,000 people in that area don't have insurance. But Nevada is also one of the states that has its own exchange, the Silver State Exchange. And what's been overlooked in some of this criticism of the system is that those states are working well. Our exchange is up and running. We've had about 1,500 applications completed. About 140,000 people have gone to the website, looked at it, gotten more information. So we are moving forward. I held a roundtable this past weekend with different organizations that are also helping us on the ground, and that's something else we shouldn't forget. Our congressional offices are acting like semi-navigators to bring people into the system. You have AARP going after that group between 50 and 65 to be sure they have information. You have campus organizations at UNLV, the community college, going after young people. Planned Parenthood is reaching out to women, and navigators in the Hispanic areas are going after Hispanic women. Las Vegas has an unusual population that's working but not insured, and a lot of those people are women. A lot of them are dancers. A lot of them are in salons. They do nails. They do hair. They'd like to have insurance. We're not waiting for them to come to the website. We're going out there after them, and it's making a difference. It's very important that they are insured, that they have coverage, that pre-existing conditions will no longer mean that they can't get insurance. And that's the word that we're spreading, and it's being very effective. So I would urge you, as we look at what's happened with the website and we are trying to fix it, don't fall prey to the ecological fallacy. Don't forget, you can see the forest, just don't get bogged down in the trees. Thank you very much, and I'll turn it over to Marc Veasey.
Dina, thank you very much. Marc Veasey, representing the 33rd Congressional District in Fort Worth, Arlington, and Dallas, and I have the highest uninsured rate in the entire country. about 40% of the constituents that I represent, about 265,000, don't have insurance. When you combine the Dallas and Fort Worth Metroplex together, you're talking about over 1 million uninsured. And contrary to what you may be hearing from Republican leaders in the state, I can assure you that that Texans, particularly in the district that I represent and in the Dallas-Fort Worth area, want the Affordable Care Act to work for them. They want to enroll, and they want insurance. I'm very happy to report that someone that I'm very well acquainted with, I read an article in the paper today, she was having trouble on the computer, but she went on the phone and she was able to enroll in 15 minutes. And so we want people to continue to try to enroll. It's very, very important that people get insured. As many of you know, Texas decided not to opt for Medicaid expansion. Many consider that to be a huge mistake by the governor and the Republican-controlled legislature. Because of that particular decision, we're still going to have a huge gap that is going to occur in the state of over 1 million people. And so even with the Affordable Care Act, Texas is going to have these problems, but it's very important that people continue to try to enroll. We feel like that the bugs in the system will be worked out. We feel like that we're making headway, and I know that the people in my district are truly anxious for this to work. And I'm going to be doing everything that I can. I've already held and been a part of 2 different programs with the Congressional Black Caucus to inform people about this. I've been a part of town hall meetings in the district, and like Dina said, going out into the community to inform people about the Affordable Care Act is something that's going to be very important. And I know that I'm doing my part, and I'm going to continue to do so because I know that there have been problems, but I believe that they can be worked out, and believe that people will continue to enroll, particularly Texans.
So as we get ready to take questions, I just want to mention in California, we too have our own exchange, and in California it's called California Covered. And I wanted to mention that in California, we have seen over 95,000 people apply for health insurance coverage in the first 2 weeks. Obviously, we're beyond 2 weeks now, but in the first 2 weeks, we saw over 95,000 Californians apply for health insurance in the exchange. We had over 1.6 million unique visits to the website in California, and over 100,000 people called the service center as well during those first 2 weeks. And so people are interested, people are anxious, and we want it to work well for everyone. We would hope that some of the states where you have the federal exchange would actually stop hindering the progress in seeing that happen. In places like Texas, we know that there's outright hostility on the part of state authorities when it comes to people finding out information about the insurance coverage that they will get. That's probably one of the reasons some people haven't had the best of experience. It would help if the local and state officials there wouldn't get in the way and, in fact, would try to help Americans gain access to what they now have as a right. And so it's very disturbing to see that the website hasn't performed as well as we would like. I think it's even more disturbing when individuals intentionally work against the American people and the rights that they have now secured to access quality, affordable health care. And so we would urge all of our colleagues in state and local government who may not have agreed with the Affordable Care Act completely to please at least let their constituents back home understand what the Affordable Care Act will provide them, and let them decide. Let every one of us as Americans decide what we want to do. But don't hinder the process and then complain that a website isn't working as well. Let's all work together to improve the website and make sure people have all the information they need so they can then make their own informed decision. With that, we'll take any questions. Jack.
We've heard from years from the other side of the aisle, they've railed against this bill. We've had problems with the rollout, okay? Some might say, well, they're saying, well, we told you, okay? But what assurances, if any, did you get from the CMS officials that things are getting better, convincing things that they said to you, yes, this is going to get solved, it's going to get solved quickly, and that come February, because as you all mentioned, your uninsured constituents, that this will work for them come January?
Well, we heard the assurances not simply from the individuals who are here from CMS. We heard them from the president yesterday, who said that he's probably the most unhappiest American when it comes to the fact that the websites didn't work as well as we all had hoped. And so I don't believe that the president's going to allow days and weeks to go by without marked improvement in the website's capabilities and the ability of Americans to actually gain the information they need. So I know that they're working hard, and we were told today that folks are working very hard within the administration and within the Department of Health and Human Services to make sure that they have the resources in the right places. Remember as well, part of this is Congress's responsibility. We have to make sure that the administration, the Department of Health and Human Services, has the resources it needs to make sure that the people and the infrastructure is there on a continuing basis to have millions of people actually transition over to getting quality, affordable health care. So we'll see what happens with that.
Congressman, should somebody be held accountable for the missteps that have resulted in this website not performing the way that it has?
And I'll let my colleagues answer, but I absolutely believe that somebody should be held accountable. We should find out as best possible where the glitches were and find out what we should do. But absolutely, when you hold a position, you should be held accountable. Just as I think those folks who were responsible for the government shutdown should be held responsible for having cost us some $24 billion, we're told, in economic capacity and generation during those 2 to 3 weeks that we were shut down. Just as we saw 800,000 plus Americans not being able to go to work as a result of the government shutdown, those folks that were responsible for the government shutdown should be held responsible in whatever ways possible. And those who might be responsible for the website not working as well as it should be held responsible as well. Let me add to
that first. That yes, one of the responsibilities of Congress is to hold people accountable. But let's not lose focus here. What's more important than anything else is to get the system working properly, not to be diverted. No diversions here. Get the system up and running. There'll be ample opportunity in months to come to look back and see how could have been done better and to hold accountable those who were not up to par in terms of the immediacy of the rollout. At the end of the day, the most important thing is to make sure that every American who wants to be covered is covered. And that's the prime responsibility right now of the administration. It ought to be the prime responsibility of members of Congress as well.
Yes, yeah, and I want to add, I mean, go back to Medicare Part D when it was passed. There was some factual or some incorrect information that was given out to the public concerning Medicare Part D. It had a very unfavorable rating amongst seniors, and now the kinks have been worked out of that. Seniors love that program. I think it has like a 91% rating compared to the 21% rating that it had when it was first rolled out by the Republicans. And I would say the biggest difference, and it's been pointed out before, is that while the Republicans have done absolutely nothing to try to help out and make this even better than what it is, they have just demeaned the program. Democrats, on the other hand, and I was not in Congress at the time, but I know that Democrats went into their district and they talked to senior citizens, had community meetings and showed them how they could enroll in Medicare Part D. And I think that is what America is looking for, are those sort of sensible solutions on how we can make this program work better for people and not try to tear it down.
I would say if there is a silver lining to the fact that there's a problem with the website, it's that so many people went to it. They want this insurance. They want to get information. They want to sign up for it. They obviously need the service. So that belies all the argument that you hear on the other side that people think this is a terrible way to go. It's the perfect way to go. It's the way to provide insurance to so many people who are obviously very hungry for it, or you wouldn't have had such a crash at the very beginning of people rushing to sign up and to get more information.
Congressman, just minutes ago, the Republicans came out and said that they would like to see the individual mandate penalty either delayed or erased. And also, we heard this morning from a Democratic Senator, Jean Shaheen, who says that at the least, the deadline should be extended. Do you think the deadline should be extended for the mandate, and should the fine for not meeting it be erased or delayed?
First, I'm not surprised that some of my Republican colleagues would once again try to either repeal all or part of the Affordable Care Act. And as the Bloomberg editorial said not long ago, our Republican colleagues continue to call for the elimination of all these rights and protections that Americans have secured through the health security law, the new health security law, but they've never offered a real replacement for it. And so every time they talk about either eliminating all or part of the Affordable Care Act, they should be prepared to tell us what they would put in its place, because Americans today no longer have to worry about pre-existing conditions. What will Republicans do to replace those rights and protections that Americans have? A child born in this country today with asthma will get coverage, health insurance coverage, whether through parents or otherwise. What will Republicans do to make sure that that doesn't change if they try to repeal or replace all or part of the Affordable Care Act? I think most of us understand that the main goal here, and especially for those of us who happen to represent the districts with the largest number of Americans who every day have to fear what most of you don't have to fear, and that is a child getting too sick to be able to afford the care. We should be worried about making sure they find out everything they need so they can make an informed decision about their health care. We believe that if we work towards making all that information available, that what we will do is we'll have Americans making the right decision. Whether or not they decide to get the insurance coverage, it will be up to them. But most of us believe that they will make the decision to get the coverage. And what we should be doing is working, as Mr. Veasey said, to try to improve the process. Because, again, it's not process people are concerned about. It's making sure they have access to the care. And that means they're willing to pay for it. They just want it to be affordable that they can pay for it. Yeah.
Mr. Becerra, CBS News reported this morning that the browse and price section has been giving incorrect pricing estimates. Do you have a comment on that?
Well, recognize what you just said. It's a pricing estimate. That browsing feature is for the purpose of giving people estimates. It's something that I think a lot of Americans wanted, is to if they're not sure what they're going to do, especially those who may have insurance and they're trying to see if it might be more worthwhile for them to get insurance through the exchange, they're interested in comparing. They're shopping and comparing. And so that browsing feature was for the purpose of giving people a general idea, an estimate of what they might pay. It's not to say that that's the final price that they'll pay, because until the government has all the information, the exchange has all the information on that individual, you can't give a precise dollar amount for the coverage that person selects. So these are estimates, and it shouldn't surprise anyone that there's some variation from the estimate in terms of what an individual will actually pay, because, again, it's represented to be an estimate for those who are shopping. And if they like the estimate, then they go further down, and then they can find out, once they plug in their personal information, what the final price will be. Yeah. I think we should find out what happened, why the websites weren't as prepared as we would all like them to have been. And then, like anything else, you're accountable for your reports, making sure you meet your deadline to issue your article on time. We all have responsibilities, and so therefore we have to figure out, in terms of the website, how can we continue to improve it to make sure that everyone's getting the information they need, and based on that, hold everyone accountable for what they did or didn't do. And I don't know if anyone else wants to answer on that. Yeah. We'll take a question or two. Last question. Well, they did explain part of the process. One of the things that everyone was surprised by was the number of people who went onto the website. And actually, I was back home. I've done a few sessions, information sessions back home. I'm going to do a couple more still for folks in my district to get the information they need about the Affordable Care Act and the plans that they can purchase through the exchange. And what we're finding is it's human nature. There's a curiosity on the part of a lot of people, clearly by those, especially in our districts, who are looking to get quality, affordable health care, but also a lot of curiosity on the part of those who have health insurance, who are checking to see, might I get a better deal through the exchange? And some folks who are just, interested, looky-loos and all the rest. And so the volume of people, the millions of people who went on the website, included those who probably don't need insurance or won't get the insurance through the website. And so that volume created a bottleneck. Well, and then they also explained that a lot of because it's such detailed information and because it has to go through various agencies, you're talking about Homeland Security, IRS, SBA, HHS, so many of the different departments in the government, that you're now having to tap a lot of different sites. It's unlike when you shop at a department store where that department store doesn't have to check with the Homeland Security Department to find out information about you, and then go to the IRS to find out a little bit more information about you. And because so many people were doing the inquiry, it did really bottleneck the process. What they're trying to do, because they expect that they'll continue to get quite a bit of traffic, is expand the capacity. And also, because so many people were just looking at first, they expect that the volume will reduce some, so that way those who are serious about moving forward will be able to access the information far quicker. And they've also beefed up their phone service, the service centers by phone. And people forget you can do this in person as well. So they're trying to make sure that they've expanded the capacity in all the different realms. But they made it very clear. When you're talking about tens of millions of people, they're going to have to really turn to the best minds and have the resources to make sure they can go through that. Wanted to add anything? Go ahead.
Mr. Chairman, I would just like to remind everybody to keep in mind these families. While we talk about the process and trying to get this system to work better, which I believe that it will, keep in mind the families. Again, over 265,000 people in the district that I represent are uninsured. Many of those families every day go to Parkland in downtown Dallas or John Peter Smith Hospital in Fort Worth, and they wait in line. Oftentimes, by the time they go through the county hospital, they already have an illness that could have easily have been prevented and cost taxpayers a lot less money had they been provided affordable health care insurance. And that's what we all need to be working towards. And I just want to remind everyone that, again, that regardless of what you may hear out there, Texans want the Affordable Care Act to work. Texans want the Affordable Care Act to succeed. The calls that I've been getting into my district office, people are telling me, okay, what do we need to do next? Because we want to enroll. And that's what I would like to leave you with today.
Dina?
Thank you. I would just say that the Hispanic population, about 40% of my district, is very interested in this, wants to get the insurance. We have special navigators who are going out into that community. We heard assurances today that the website and all the information at the national level will be up in Spanish in a couple of weeks, by the middle of November. I think that will also be an important improvement that they assured us of.
If I could, we're going to close it, but we could take questions later on. I just want to close by saying this. In my state of California, since the Affordable Care Act became law, seniors in California through Medicare have saved roughly $450 million on prescription drugs, simply since 2010 when the law passed. We have 95,000 Americans today in our state of California who have now applied for and will secure starting January 1st insurance for their family that they didn't have before. As Mr. Veasey said, if we're focused on the prize, and the prize is to make sure never again do American families have to worry about whether they can pay the bill or pay the rent, pay the bill for health care or pay the rent, or whether or not the child will get the kind of care that that family needs for their children. I think what we're doing is giving people in America the peace of mind so that they know that if they work very hard, if they play by the rules, they will have a chance to make sure their kids do even better than them. That's the American dream. That's why we passed the Affordable Care Act. We want to make sure that in every respect it works well, including with the website. But if we remember what the goal is, if we keep our eye on the prize, and that is to make sure no American has to go into bankruptcy because he or she has to use health care services for their child, then we'll succeed at this if we work together. So that's what we hope to do. We thank you for being here with us this morning.